Hi, I'm Dr. Molly with Your Goals Physical Therapy. Let's talk about carpal tunnel. Carpal tunnel is so common, especially for moms. And if you've just had a kid, it's common to get carpal tunnel while you're pregnant, but it is also common just from holding your child that you get carpal tunnel as well. Case in point, myself. So my daughter, after she was born, she just loved to be carried. So she didn't really like to be put down for any length of time, and so you just spend a whole lot of time carrying. And of course, you're kind of curled in this position. You're trying to make sure that they're comfortable, and you're doing a whole lot of this, right, all day. And after a while, I noticed that my wrist would be a little bit sore and achy. My elbow was getting sore, and because you're not sleeping a whole lot, there's not a whole lot of thought. You just know that you need to take care of your baby, and then that's what you're doing. But when I started to try to reach for things, and I was like uncoordinated, and I would drop things because I didn't really have as good a grip as I thought I was. And then the numbness came. And then after the numbness came the realization that I am giving myself carpal tunnel on my left side. And so I made some adjustments on how I was holding her, got, one of those things, baby carriers basically, so that I could hold her the way that she wanted to without having to put stress on my wrist. And then I started doing all the exercises that I know that you're supposed to do to help. And I'm happy to say that my wrist no longer bothers me. I have all the function of my hand. Everything's wonderful. But carpal tunnel is one of those things that is sometimes it's hard to fully diagnose correctly, and it's also can feel like it takes forever for it to heal because it's your hand, and of course we use it all day, especially anybody who types. I've worked with people who are machinists, and they work with tools and they do kind of the same motion all day, and so it can be. And of course, if you're again a mom where you have to hold your kid, you have to. There's not really a choice in this. So constantly holding yourself with your wrist in a flex position and just there all the time, it just allows for carpal tunnel to kind of sneak in. The other tricky thing is that what can be diagnosed as carpal tunnel, because you have all the symptoms, like the numbness in your hand, the weakness, uncoordination, could also be coming from your shoulder. Because all of the nerves that run down your arm come out of your shoulder and then go underneath your collarbone and then then they go down your arm, and that's how we have function. So especially for moms after having kids, right? We're already pulled forward because thank you, pregnancy. All snuggle time is down in this position. And so you're putting more pressure on those nerves just by having that forward posture. And then you're trying to hold this cute little cuddly thing and try to keep it safe and feel comfortable and secure, and for sometimes hours. And so it just precipitates anything that can make your nerve, it can make your nerve agitated anywhere from the neck when it comes out of your spine all the way down anywhere in your arm. So when you go to a doctor and you're like, my hand's numb, they could tell you have carpal tunnel and not even look anywhere further. And so, and that honestly, sometimes it gets rid of your pain anyway, so no harm, no foul. But sometimes if that pain or that numbness and tingling didn't quite go away the way that you were hoping for, that is something that I help people tease through. Because we're going to look at your elbow and your shoulder and how everything's working together and find out where that nerve is really irritated, or if it's irritated at multiple levels. Go big or go home, moms, right? So if you're going to irritate that nerve, it might as well be anywhere along that line. And so some people ask, well, are there stretches and are there positional changes that I can do that can get rid of it? And most definitely, we would definitely talk about how to adjust how you're holding your baby, or maybe how your workspace is set up if that's really where the problem is. But and stretches is a big part of it because you want to be able to pull yourself backwards. But the truth is that those muscles, even if you stretched them into the best possible position and you're in the most ideal position possible, if those muscles no longer know what they're supposed to do because of how long it's been in this condition, or how stretched it is, and and how agitated the nerves are, then all that stretching will help reduce your pain, but it won't necessarily get rid of your symptoms. And that, I think, is when people stretch and they move around and it doesn't get rid of it, especially when they're doing that on their own. I think that's when all the anxiety comes. They're like, oh, I've been stretching and I've been doing all these things. I've been icing. I changed how I'm holding my baby. I'm doing all these things that the doctor told me to do, but this pain is still there. It has to be so much worse than what they think it is. It cannot just be carpal tunnel or whatever. It just has to be worse because nothing should be this painful. And in truth, you could be doing absolutely everything that you can, but it's really hard to make your body move in a way that doesn't feel normal to it. And if you've been moving in a certain position in a certain way, then retraining that, you would have to know what you're supposed to be doing, right? You'd have to understand what is supposed to happen. And look, especially new moms, we have too many things to pay attention to try to remember exactly how I'm supposed to move and how I should have moved more than 9 months ago, right? And that's where I was, right? Even me, like I had to really think about what was going on in my body before I realized I was giving myself carpal tunnel and then go and do the things that I know to fix it. And so as a new mom, give yourself a little bit of grace and just see if talking with somebody will help you alleviate the anxiety that goes along with your arm going numb, your hand going numb, and being afraid that you're gonna drop items and worse, your kid, right? I mean, that would be absolutely devastating. And so if this is something that you're dealing with right now, feel free to reach out with me. We can talk and we can just find out if physical therapy is even the right place for you to start. And conversations, I just love talking to people. So I don't charge to have a conversation. Let's just talk and let's make sure that you're going into the right place so that you can feel like you own your body again. I hope that this information is very helpful, and please, please, please share this information with anybody who would benefit from hearing it. I hope you're having a good day. Bye.